I've lived in Forks most all my life. I'm 58 years old. I was gone 7 years to school and lived here the rest of that time. My wife and I run a bed and breakfast on the edge of town. We take care of, anybody that comes to visit, people that are working here, fishermen, people that are coming to visit the national park, and recently Twilight fans coming to see the town of Forks. Forks has a very delicate fabric, I guess, of how we exist here, both in jobs and in the services that are provided to the town. And without a hospital, we have 60 miles to go to Port Angeles or 100 miles to go south to Aberdeen. If we didn't have a hospital here, we'd be losing people.
Well, I think that's one of the important aspects of this community. Here you are in what some people would say is the middle of nowhere or a very rural area, and yet we have this world-class hospital and also hospital clinic with a lot of very qualified physicians and practitioners to care for us. So we feel quite lucky.
Well, the great thing about a public hospital district, it's owned by the patients and citizens of this community. We're a nonprofit governmental entity that's focused on providing the best possible health care to our local community. And it's very rewarding for our medical staff and our employees because our mission is very significant to our community.
Our hospital district covers 800 square miles of northwest Kittitas County.
We are a 25-bed critical access hospital, so the only hospital in Jefferson County.
Soap Lake is a small community. It's one of the communities included in the district. We're a 42-bed facility. We do long-term care, that's our specialty.
No matter whether it's a public district hospital that's in an urban area or a suburban area such as we are, or in a rural community, each one has its differences and its special nature, but there is a common theme.
As a public district hospital, we receive taxes from our district residents, and that's the difference between being a public district hospital and not. And so roughly 5% of our revenues come from a tax base.
Those funds help us to do amazing things in our community that otherwise wouldn't exist, because there is no sound business model underneath of them to allow them to exist, and yet they very much need to exist. Senior services, grief and bereavement, the ability to have a 24-hour nurse call center.
I would think that a hospital out here, if it wasn't a public hospital, would be challenged to financially manage itself. Say a privately held hospital, I think probably what would happen is there would be some clinical coverage, but there wouldn't be the full-scale hospital that we're so blessed to have here.
Growing up, I can remember times with 105-degree fever and, mom bringing me down. And, when a mother is worried about her child, then they need a place to go to. So this is it.
The public hospital district model is basically a model that allows the local public to be involved in the leadership, provide a board and the leadership and community support to the hospital.
I'm currently the president of the Board of Commissioners. I'm a commissioner for Public Hospital District Number 2 in Clallam County.
And we've invited the general public to show up and voice their suggestions.
Our job is to make sure the policy is set, to see to it that we're running legally. We have fiduciary responsibilities of various kinds.
There's a different connection that our commissioners have compared to other organizations I've found, where they not only help govern strategy, policy, selection of the CEO, but they are representatives of the community, and it creates just an additional but very powerful connection.
We are constantly talking to our community and getting feedback from our community. One big thing is our Sequim residents, which are about 16 miles away from the hospital, really wanted some kind of urgent care walk-in clinic. So if they needed urgent care, they didn't have to come all the way to the hospital and wait in the emergency room. So a couple years ago, we started a walk-in clinic in Sequim, and that's been very successful.
The hospital is such an essential component of our social fabric that it just feels good to have something to do with it, to have some ability to control what happens.
Together with Olympic Medical Center, who is also a public hospital, we were able to join with them as well as Forks and form a coalition. With this coalition, we were able to develop an improvement in buying power as far as being part of a larger buying group and access to upgrade in our medical information technology.
District 1 and District 2 have an interlocal agreement which spells out some services that they can provide to each other.
I've been fortunate to be able to travel across the state and across the country and talk to peers in emergency medical service and see other systems for areas of this size. And what my experience has shown me is that because of the relationship that we have between Hospital District 1 and District 2, we're able to provide better services and a higher level of patient care than would otherwise be available if that partnership did not exist.
Healthcare is really local, and having a local public hospital district working with the entire community, including the other healthcare providers in the community, that's the way healthcare reform is really going to happen. Making this healthcare delivery system better isn't going to happen in DC or even Olympia. It needs to happen boots on the ground in the community, working with a variety of partners.
There's many moving parts to the Affordable Care Act, and we're hearing there's a lot of new terms and new concepts being brought forth, including accountability, the accountable care organizations and payment for performance. My conclusion about a public district hospital, in addition to the things we already talked about, it is the essence of an accountable care organization. We are an ACO even before that became a popular term.
We're totally committed to this community. That's all we do. And I think that adds a level of engagement that makes a difference for our patients. Public hospital districts are very unique. And I think in rural areas, given the economic pressures, a much larger population of poor patients and elderly patients and uninsured than urban hospitals. And I think it requires unique dedication and focus to meet a community's needs.
My mother, in the last year of her life, spent a year here at the Forks Hospital long-term care. And it was so nice for us because she was in Forks where we could visit her every day, evening, morning, whenever we wanted, instead of making a long 60-mile trip to Port Angeles. And because the hospital is under the jurisdiction of a board of directors that are elected, they're very accountable to the needs of the community, and one of those needs is the long-term care. And so I just think that she got the best care possible. I consider all of her caregivers a group of angels, and we just couldn't be more pleased. And I don't think we would have that without this facility here.